Hello and welcome back to GP Video Podcast by Nadia. So as you guys know that this morning I started the topic of diabesity, which is a combination of diabetes mellitus type 2 and obesity. It is a term equivalent to metabolic syndrome that we use in Australia, while diabesity is a term which was coined in US by US General. So then I said that in diabesity the best management outcomes are achieved when we use, along with exercise and diet, we use the weight loss medications as well, as I am one of the biggest advocates for weight loss medications, especially if somebody is suffering from diabesity, which is type 2 diabetes mellitus and obesity. So there are, and as I said in my other podcast as well, that there are anti-diabetic medications or oral hypoglycemic agents or injectable hypoglycemic agents that are there to help you with the weight loss. But just remember that not all oral hypoglycemic agents cause weight stagnance or stop you from gaining weight or cause weight loss. Some of them can cause weight gain as well, so we have to be really careful and we have to ask our GPs that which are the ones that can actually make me cause a bit of weight gain, like make me gain a bit of weight. But usually the anti-diabetic medications are very good. Either they stop your weight gain or they cause the weight loss. And actually the injectable anti-diabetic medications are the best ones for weight loss. So they are number one in obesity management, but I've already discussed them earlier. I've discussed Wegovy, I've discussed Mounjaro, then there is one called Saxenda. They are all very good and I will actually come back to them because weight loss and obesity management is my most favorite subject in general practice. But today the drug that I'm going to, I'm going to actually start with the oral medications that are used for appetite suppression. It can be used both by diabetics and non-diabetics. That's not a problem at all. But oral medication safety profile is not too great. I mean, they can be used generally, but the only issue is that, especially the one that I'm going to talk about today, which is called phentermine or Phentodur or Duromine. Phentermine is the actual pharmaceutical name and Phentodur or Duromine are the brand names. This medication is very, very good. I have used it myself and it's actually a very nice medication for appetite suppression, but there are some issues associated with it. Number one issue is it's not a long-term medication. So if you are using it daily, then you can maximum use it for 3 months. But if you are doing it alternate days or every third day, you can stretch it up to 6 months, and then you have to go off it for a while, and then if you want to resume it after a couple of months, you can do it again for 3 months. And preferably you shouldn't come back on it. But then there are people who go off then come back, go off then come back. Then I would, if such people are my patients, I definitely would just put them on GLP-1 agonists, which are the injectable injectable hypoglycemics or injectable anti-diabetic agents, which are used for weight loss as well. But because for beginners it could be the first choice, and it is a very good choice for the beginners, but there are certain contraindications. So I'll talk about this medication in a whole. What are the pros and what are the cons? Okay, so as I said, the name is the actual name is Phentermine, but the brand names could be either by the name itself, Phentermine generic brand, or Phentodur or Duromine. So Duromine is actually most popular. As I said, it's oral. Number two, as I said, it's an appetite suppressant. Number three, it is in Australia, it is approved for weight loss, but it is not on PBS. So it is a private script, and Duromine is actually, I think, the most expensive brand of this drug. But if you go for generic brands like Phentermine itself, it comes by the name of the generic brand as well. I think it's a bit cheaper. I think Chemist Warehouse has it the cheapest, but I think at some other pharmacies you can price match it as well. Yeah, it's not like it the first dose, so it comes in 3 different doses. 15 milligram, which is the smallest dose, which I always start my patients on 15 milligram if they are the beginners or the first timers, because of course you want to check whether the patients are allergic to it or not, or how are they tolerating it, if there are any imminent and side effects or such side effects that you would like to, would like them to straight away stop it. So yes, so 15 milligram, it could be anything under $100, but then 30 milligrams and 40, so it comes in 3: 15 milligrams, 30 milligrams and 40 milligrams. And then according to the dosage, the prices go up to as well. So anything ranging from $80 to $150 a month, a packet, it costs. Okay, so as I said, the other thing is it's a short-term medication. Why is it a short-term medication? I'll come to it as well. Then basically what happens is that phentermine is combined with a product called resin or some chemical product which actually makes it slowly release throughout the day, so the actions of phentermine lasts for for the 24 hours. Okay, so yeah, so it is a psychostimulant. It is a brain stimulant, and it actually works on the noradrenergic pathways such as amphetamine, which is again a psychostimulant, and causes appetite suppression. So it increases your energy levels, it increases your concentration levels, and it also suppresses your appetite. But unlike amphetamine, which is again a very important psychostimulant, it does not work as such on the dopaminergic system, and thus it has got lesser profile of addiction. Amphetamine acts both on noradrenergic system, which increases your concentration, energy, and decreases appetite, and dopamine, which actually has the similar properties, but that has the dopamine pathway has the propensity or tendency of getting addicted. But because phentermine doesn't work on it, it doesn't have that. So it does have it, but to a much lesser extent. So it's not as addictive as amphetamine is. Amphetamine is used where it's used in ADHD. I'll come back to this topic tomorrow.